All right, now I'm going to have to ask about the president because you talked about testing and how important it is. And Admiral Giroir and I know how important it is. At his rally over the weekend, the president said, and I quote, "When you do testing to that extent, you're going to find more people, you're going to find more cases. So I said to my people, slow the testing down, please," unquote. And this morning he said he meant this. So Dr. Fauci, do you agree with that? Does it make sense that to safely open our economy, we should be limiting the number of tests rather than ensuring that anyone who needs a test can get one? And you don't have to mention the president, I did, but tell us about the testing.
So I, as a member of the task force,
Your microphone is on.
Sorry. I, as a member of the task force, and my colleagues on the task force, to my knowledge, I know for sure, but to my knowledge, none of us have ever been told to slow down on testing. That just is a fact. In fact, we will be doing more testing, as you've heard from Admiral Giroir, not only testing to specifically identify people in the identify, isolate, and contact trace, but also much more surveillance if you want to get your arms around and understand exactly what's going on in community spread. So it's the opposite. We're going to be doing more testing, not less.
And then let me just ask the same question of Dr. Redfield. Do you agree with the president on this? Or do you think we should be testing more people? You don't want to talk about the president, just tell us if you think we should be testing more people.
Yes, Dr. Fauci said, all of us have been and continue to be committed to increasing readily, timely access to testing. We've made a marked improvement. We still have a ways to go. One of the key things, as Tony mentioned, is surveillance, expanding surveillance because of the asymptomatic nature of this infection. And in doing so, we're looking at ways that can really substantially enhance testing by potentially pooling samples. So right now, as Gerard said, we're doing 500,000, 600,000 tests a day. If we can pool samples 5 to 1, that would bring it to 3 million tests a day. So we're continuing to try to enhance testing. It's a critical underpinning of our response.
It's been a remarkable hearing, updates on a number of topics, vaccine research, the spread of the coronavirus. The biggest headline, you cannot believe the President of the United States in the middle of a pandemic. That, the words of his own experts, in translation, if you will. The President over the weekend said he had asked his experts to stop the testing, to slow the testing. He says he doesn't like to see the higher case numbers. All 4 of the administration officials on hand saying that has never happened. The President has not asked them to slow testing, although even just this morning, the President said he was not kidding about that. Also, watch the President's interviews in recent days. He says the coronavirus is fading. It is dying out. It is in the rearview mirror. The President wants you to believe. Listen here. This is Dr. Anthony Fauci, the top infectious disease expert in the United States of America.
We are now seeing a disturbing surge of infections that looks like it's a combination, but one of the things is an increase in community spread. And that's something that I'm really quite concerned about. The next couple of weeks are going to be critical in our ability to address those surgings that we're seeing in Florida, in Texas, in Arizona, and in other states. They're not the only ones that are having a difficulty. Bottom line, Mr. Chairman, it's a mixed bag. Some good and some now we have a problem with.
Let's bring in our chief medical correspondent, Dr. Sanjay Gupta, and also Dr. Rochelle Walensky. She's the chief of infectious diseases at Massachusetts General Hospital in Boston. Dr. Gupta, I want to start with you. The President of the United States says fading, dying out. If you've been listening for the last hour plus, the coronavirus is anything but fading and dying out. Dr. Fauci saying this is a crucial couple of weeks as he sees a surge in cases in many places and starting to see an increase in hospitalizations following it.
Yeah, he also went on to say after that sound that you just played that we have been, quote, hit badly, was how he described it. And look, I mean, if you were looking to this briefing, this hearing, to feel better about things, you probably are not going to feel satisfied after listening to this. There's a lot of concern, as softly sort of spoken as they are, and all of these members of the coronavirus task force are quite expert at what they're saying. But if you listen closely to what they're saying, there's obviously a lot of concern. You can see the numbers on the right side of the screen, the United States versus the rest of the world, 25% of the overall cases, 25% of the deaths. One thing I want to also point out is that, you talk about the testing a lot and this question about testing. All of the members there said that they had not been directed, as you said, John, to slow down testing. But it is also worth pointing out that we are nowhere near where we should be with testing. Okay, so whether they were told this or not, the outcome is that some 500,000 or so tests are being performed per day. Admiral Gerard said by the fall, maybe they'll get to 40 million per month. But it's clear, that we need a lot more. If you look at these roadmaps to recovery, they say by this point we should be at 5 million per day. Testing. That's in order to really get good surveillance on this. So, that was a significant concern. But again, the idea that things are ticking up, that we are close to where we were at our peak in terms of numbers of cases and things like that, that was a common theme from everyone that was speaking today.
And one of the challenges, Dr. Walensky, is who do we trust and who must we trust in the middle of a pandemic? I say that in the context of the president says, I told my people to slow down the testing. All of his people saying he did no such thing. Good. That's great that he didn't actually do it, because that testing is what gives us the gold mine of information that allows you to understand the challenge in front of you. But when the president says he did ask that, and then he says he wasn't kidding, and the Republicans in Congress have to ask the officials to go on the record and make clear that he did not, that's one issue. And then there's the point of, again, are we going up or are we going down? Are we in better shape or worse shape? The president says dying, fading out. You heard from Dr. Fauci saying a crucial couple of weeks as there's a surge, his word, in several states. But the CDC director, who we know the president is mad at for the testing mishaps early on, Dr. Redfield said while overall case counts are going down, several communities are seeing increased cases. How can he say that? How can he say that? 6 weeks ago, when Dr. Fauci last testified, we had 82,000 deaths, 24,000 new cases each day. 6 weeks later, we're up to 120,000 plus dead, 28,000 new infections each day. How can you say overall case counts are going down?
Right, it's a really key point. One of the things that I want to emphasize is to think about where we were if we were to rewind the clock when things shut down, when the economy shut down. End of March, we were all talking about mitigation, flattening the curve. At that time, we had 20,000 new infections per day. We have about 50% more new infections per day now as we did then, when we were talking about all of these mitigation strategies of the masks, of social distancing, of staying home, of stopping travel. And so I want to say, we're really in a worse place now than we were before. Now, what we did do was flatten the curve. What we did worked. The problem is that as we open things up again, as people get more cavalier, we're really not in a better place now than we were at the time all of those draconian measures were taken. It's really hard to think about how we're going to contain this now in the setting of things opening up, when what you really need to do is contact trace 30,000 people. We simply don't have the resources, we don't have the capacity to be able to do that in any structured way.
And a ramification of that came up in the hearing right before we dropped out. Dr. Redfield raising the possibility, said this will be done jurisdiction by jurisdiction, but so much of the country is planning to reopen schools in a couple of months, and that could be in play, in serious question if this continues. I want to bring in our Caitlin Collins. She's over at the White House as well. Caitlin, the President of the United States is on his way to Arizona, a state that is in the middle of a surge, a state that's reporting more than 50% new cases this week than it has last week. He said this morning as he was leaving that he doesn't kid. He said at the rally over the weekend, I've asked my officials to slow down testing. Then there was scrambling in the administration for officials to say the president was just joking. He has not asked that. The president says he's not kidding, but I want you to listen. These are two of his experts this morning at the hearing saying, no, the president has never told us that.
None of us have ever been told to slow down on testing. That just is a fact. In fact, we will be doing more testing.
We're continuing to try to enhance testing. It's a critical underpinning of our response.
In the middle of a pandemic, two of the nation's top experts need to take time to say, no, the president didn't tell us to do that thing he said that he told us to do.
Yeah, and John, you also did not hear those officials testifying that they believed testing is a double-edged sword because, of course, if there is more testing, the argument that you've seen the president and the vice president make in recent weeks is they're saying that's the reason that you're seeing these new cases. And Dr. Fauci and the other health experts are telling a different story, saying that they are troubled by the surges in certain states where the numbers had looked good for a little bit of time, but now they're concerned. States like Florida, Arizona, where the president, of course, is going to be today, Texas, all of these others that they're talking about, and they say we're not going to be slowing down on testing at all. We're going to be ramping it up because, as you know, Sanjay was pointing out, the levels that they're at right now is still not where a lot of health experts say that they need to be. But this just adds to the confusion that you're seeing that plays out here at the White House over who's speaking with authority on what's going on with the task force, because the president made that comment. They said he was being tongue-in-cheek. It was in jest. You saw that repeatedly from the White House press secretary yesterday. And then, as we have seen so many times before, the president undercuts his own spokespeople, his own top aides, by saying, I don't kid. He actually believes that about testing when it comes to coronavirus. And so they say they have never been instructed to slow down testing. John, that's interesting. And it makes me think back to the impeachment hearings when we were talking about the hold on the aid to Ukraine, when so many officials were saying they hadn't been explicitly told, do this to get this, but they said it was clear what the president wanted them to do. And the question is, you know, is this one of those situations?
When the president's staff has to tell us to pay no attention to the president in the middle of a pandemic, it is quite remarkable. Caitlin Collins, Dr. Walensky, Dr. Gupta, thank you.